So generalised low back pain. Within the chiropractic profession, we don't tend to just use that phrase. We tend to call it uncomplicated mechanical low back pain. Bit of a mouthful, but it means really that it's muscle and joint based rather than for any other reason. So your low back is this area of your spine here. So we've got mid back, and then this is the lower back and the pelvis. And low back pain tends to come from the bottom 3 or 4 segments within the low back, and also from the SI joints, which we will come back to later here, these SI joints here. Now, low back pain can be local to the low back, or it can be radiating into buttocks. And it tends to be caused by joints and muscles again in that area. And these joints, as you can see, should move quite happily, open and close. And when they don't, for whatever reason, especially if you've done a period of long sitting, or you've done some heavy digging, or you've just put your body into a position that it's not used to, those joints get quite stiff. And as they get stiff, they get inflamed, and around the inflammation you get irritation, and that gives you local back pain. But it's mechanical, it's of an origin of joints and muscles, which is something that chiropractors can resolve very nicely. So what can we do to help? If the joints are restricted and tight, the idea obviously is to loosen those joints up and getting them moving as quickly as possible. That reduces the inflammation and the pressure on the muscles and the joints around the area, and that in turn reduces the amount of pain. So what we'll do is we'll find the segment that seems the tightest, and we will mobilise or manipulate or adjust that area in whichever way seems most appropriate for the patient, thereby reducing that inflammation, and the pain will reduce quite quickly. Also, you'll find that most generalised low back pain will have a lot of tight muscles, both locally to the area but also into the tops of the buttocks, because of the mechanism of how people stand and sit. So again, releasing those muscle groups with soft tissue work, stretching, trigger point therapy will help that whole area heal very quickly. We'd also give quite a lot of advice as far as speeding up that healing process using ice and stretches, and this cools down the area and generally takes away a lot of the pain. So ice to the lower back can be quite helpful with most people. We tend to say no more than 15 minutes, and make sure it's wrapped in a tea towel, please, otherwise you'll give yourself quite nasty freezer burn. But also stretching of that area, please specifically give stretches for that area, nothing general, but stretching of that area will loosen that muscle group and give you quite a lot of relief quite quickly.